ሰላም ክቡራት ተኸታተልቲ መደብ ዕላልና ፖድካስት ሰናይትን ሮዚናን ንበሃል ኣቕረብቲ መደብ ዕላልና ፖድካስት ኢና
እንኳዕ ናብ ዕላልና ፖድካስት ብደሓን መጻኹም ኣብዚ ፖድካስት ኩሉ ነቕርቦ መደባት ብቋንቋ ትግርኛ እዩ ዝተፈላለየ ሓናፅን መሃርን መደባት ሒዝና ድማ ክንቀርብ ኢና ብዛዕባ ኣብ ስደት ከጋጥሙና ዝኽእሉ ብድሆታትን ብኸመይ ንገጥሞም ከዓ ኣብዚ ፖድካስት እዚ ትምህርቲ ሒዝና ክንቀርብ ኢና
ኣበይ ተወሊድና ብዘይገድስ ኣስመራ ኣዲስ ኣበባ መቐለ ካልእ ከተማታት ኤርትራን ኢትዮጵያን ወይ ኣብ ካልእ ኣፍሪቃን ንኩሉ ተዛራባይ ትግርኛ ተማእኸል ፖድካስት እዩ
ኣብዚ ፖድካስት ዝተፈላለዩ ኣብ ሂወት ከጠቕሙናን ክምህሩናን ዝኽእሉ ዛዕባታት ሒዝና ክንቀርብ ኢና ናብራ ስደት ንኽንምክቶ ዝጠቕሙና ጥበባት ባህሊ ኣተዓብያ ቆልዑ እምነት ወግዕታትን ክብርታትን ዝተፈላለዩ ሕብረተሰባት መንነት ብፍቕሪ ምንባርን ኣፈታትሓ ግጭትን ካልእ ሒዝና እውን ክንቀርብ ኢና
ኩሉ ነቕርቦ መደባት ከዓ ንምሕያልን ምህናፅን ኣብ ስደት ንዘለና ዝዓለመ እዩ ኩላትና ብሓባር ንክንዓቢ ድማ እዩ
ታሪክ ዝተፈላለዩ ሰባት ብምምፃእን ካሃንፁናን ውሽጥና ክፍውሱናን ዝኽእሉ መሰጥቲ ዕላላትን ምኽርታትን እውን ከነቕርብ ኢና
ቡንኩም ወይ ሻይኹም ሒዝኩም ንሳና ብሓባር ክትውዕሉ ወይ ድማ ከተማስዩ ከዓ ንዕድመኩም
ደጊምና እንኳዕ ናብ ዕላልና ፖድካስት ተዓቢሉን ትህነፅሉ መደብ መጻእኩም ንብለኩም
I would like to introduce our guest today, Dr. Yonas. He's a high achiever, so I am going to read a little bit about him. So Yonas Keleta received doctoral as well as master's degrees in neurobiology and biotechnology, respectively, from University of Texas. He's currently associate professor at the School of Advanced Studies, University of Phoenix and Zhejiang Normal University, Junhan City, China. And he is a strong advocate for equal opportunity in education and has a strong belief in family values. He engages his students in theoretical and practical applications of the learned materials. Thus, he urges his students to obtain the meaning of theory through relating the learned subject matter with real life stimulus. I told you he's very well achieved. Dr. Keleta's professional interests primarily focus on neurodevelopmental related learning difficulties. He's current, just admitting people, that's why I'm pausing. His primary focus on neurodevelopmental related learning difficulties. His current project includes brain circuits and reinforcement learning and the epidemiology of autism in developing nations. Dr. Keleta serves as a doctoral dissertation chair for University of Phoenix at the School of Advanced Studies and supports doctoral students with their doctoral thesis for IRB approval. Moreover, he is a peer review editorial member for the Journal of Brain and Behavior. He recently obtained Certificate of Honor for Peer Review Contribution to the Journal of Chemistry, Biology, and Behavior. Dr. Keleta also works as an independent consultant. As an independent consultant, he has been working as a neurodevelopmental expert for learning difficulties as a data mining and data analysis expert, consulting organizations with their research and statistics needs. Dr. Keleta believes that one way to bring economic prosperity in the developing nations, such as countries in the Horn of Africa, including Ethiopia, is by promoting neuroscience education at all levels of the education system, beginning as early as kindergarten all the way to higher levels of graduate and postgraduate programs. Dr. Keleta has many publications and a book on autism that's published in 2019, which is already translated into Amharic and Tigrinya. I actually have his book here for people who want to have it. So thank you so much, Dr. Yonas Keleta. I really appreciate everything that you do for our children, promoting, advocating, and all of that. and I would like to welcome you. Thank you for taking your time to be here. I'm a big fan. And I also met you in 2015 when we started RNK Foundation, and you gave such a wonderful presentation for RNK Foundation on what's cerebral palsy, which was another topic. But thank you so much for being here and being here to teach us about autism. So I'll give you the floor.
All right, Sanait, yeah. You don't mind if I call you Sani or?
No worries. We're friends after all, right?
Yeah, that's how I call it. Like it's a, you know,
Right.
if you're very close, yeah, kind of, yeah. So we
Right.
use Sani, Sanait. But, you know, thank you so much. I really appreciate you for hosting this and for really trying to your best to bring us together, despite the fact that you have a lot of, you know, things going on in your life. And that is really, I mean, I really do appreciate you. Your effort and your energy is always appreciated. But, you know, because we don't have enough time, I have to go straight to our slides and say something. So I just want to ask the audience if they can hear me. I mean, if I have to fix something before I start. I don't know if you are, if you can see them or how can they
They can
in
chat.
and say,
Yes, they
Yeah.
can chat. Can
So-
everybody tell Dr. Yonas if you can hear him?
Yeah.
Okay.
yeah, also they can interrupt, okay? I'm okay with that. They can ask questions.
Yeah, I see a
and-
thumbs up. I see one thumbs up.
Okay, yeah.
Okay. Everybody can hear him okay? Can you? Yeah, I'll monitor. Yeah, I
Okay,
got
cool.
another one. Yeah,
Share.
okay.
Okay, cool. Yeah, because, you know, we have to be on the same page. I don't want to confuse everyone. And also we might have a little bit problem with the network. So if so, it might not last like 10, 15 seconds. So get back. So be patient with us. So again, I would like to, you know, thank you for inviting me for this really, because it's a Autism Awareness Month. And I was actually asked by some people here to do something, but, you know, I feel a member of the EPI, I'll call it EPI, Empowered Immigrant, and the word EPI means on the top. So hopefully, you know, if we work together, we'll be at the top with respect to the empowered immigrant. So I will just give you a snapshot of from my book and the 6 chapters, the general topics. And I'm not gonna go through some of the topics, but, you know, I'll give you a little bit of introduction. And then some of the prominent characteristics of autism. And then what kind of behavioral therapy and intervention we can do. Chapter 4 and 5 are a little bit to the person who's a little bit exposed to neuroanatomy and neurophysiology. And because this book is based on peer-reviewed research. It's all like taken from like hundreds and hundreds of research, peer-reviewed research. So it focuses on research, evidence-based practices and all that, and what's happening in the brain areas related to somehow correlated with autism and all that. And we're not going to cover that one today. Maybe I might have one slide on that. But, you know, if you need more detail, we might have to have a specific schedule on that. Even this 5th one is like some of the variables that contribute what are the causes and all that, which we don't know, but the genetic and environmental predispositions are mentioned on chapter 5. I'll take a little bit of contents from chapter 6 as well, advice for the parents and caregivers, because when I started writing this one, it was mainly to help people in the diaspora who are having a lot of burden, not only about their life living overseas, but also with new things coming into their life and being confused. So primarily was originally targeting the Ethiopian and Eritrean community, but when I look at it, the book is a global book. It applies to everyone, especially the immigrant community, because you're coming in the new environment and you're confused what to do. And then we have this very, very difficult disease called ASD, autistic spectrum disorder, which I will talk about later. That is not only for us, but for even people who've been living with it and researching it, and still confusing. So, so I'll focus on, a little bit on the history, a little bit about the prevention, and a little bit about the prominent symptoms, and then a little bit of therapy, and then a little bit of advice. Okay, so you have heard the word autos, or like autonomic, or auto means like self-generated. So this word came from the Greek word autos, okay, means self-governed or self-generated or from within. Like, for example, we say autonomic nervous system. That means a system that's sometimes not governed by the central nervous system. So basically, it implies that kids with autism have or show behavior that is self or initiated or self-generated. Okay. Now, just bear with me. I'm going to read this because it's he's like, of course, paraphrased in my own word, but it was taken from an archive, historical archive, an incident that happened about 250 years ago. And it was about a patient who had an issue, which will later call it autism. It was in 1974, Blair appealed to the court. The third thing about the story is that the accuser was his own brother. And the excuse was that Blair was incapable of leading household due to recklessness. But the truth of the matter was that the brother wanted to get all the inheritance that belongs to him or to Blair. So the story goes like that. And some of the problem he had included tactlessness, abnormal gaze, language, like kind of retardation. Sorry about that. Repetition, or like repeating words, okay, phrases. We call it echolalia, okay, echolalia. I think there is a problem with the network. Can you hear me now? There was a problem with the network. It's good?
Yes, it's good now. Yeah, it was temporarily like that, yeah.
Yeah, okay. So language problem, repeating words. Can you let someone is getting in? So I don't know how to let that person, somebody's calling. Motor mannerism, all these are things that we see, like collecting feathers, sticks, sitting on one chair and only one chair all the time. It just goes and sit there. And people used to think he was an idiot, which is politically, and not only politically, but humanly stupid to say that. And he was perceived by others as healthy but idiot. Okay, so But apart from these behavioral deficits, he had no physical disabilities. And in fact, after few time, he ended up being a very socially friendly person. And this was taken from Sula Wolf in 2004. So you can see that, it's been long time, the issue of autism and autism related behavior been there with us for long, but research about it hasn't been conducted for the last 70 years. The first journals on autism appeared in like about less than 70 years ago. And after that, we have like tremendous amount of number of journals now focusing on especially purely autism related, ASD related research. And so what research says, let me just pull this screen. It's blocking some of my stuff. Okay. So research says autism affects the aspect of demographic features, irrespective of gender, religion, social, economic status, geographic location, race, we all are affected by it. So it doesn't, but that doesn't mean there is no variability, okay? Especially in gender, there is variability in gender, okay? And which I will touch a little bit. However, clinical studies show that males are 4 times, okay? If you notice, like, if you go out there and see, like kids with ASD, autistic spectrum disorder or autism, 4 out of 5 are boys, okay? And that has been studied well. And the reason why and all that, up to the genomic studies shows that, somehow, some way, the Y chromosome is implicated. This is a table that I took from the book, and I referenced that the data was actually kind of extracted and then modified from More 2008. And as you can see from the table that, this was like from thousands and thousands of kids, and about 84% were male and about 14.6 females affected, okay? And also they looked at their socioeconomic status, and people or kids who had lunch who happened to eat more than needed, or of course, in the United States, we see the kids consuming a lot and junk stuff and all. That might be also another thing. So because you can see here about more than, the kids without lunch restriction were a lot more than those who had lunch restricted, meaning they have to take a certain amount, a certain type, and all that, okay? So then this is telling you somehow, some way, the disease, autism, might be related to what we eat. Despite also, again, because a lot has changed with nutrition and all that, like the GMOs and all that stuff. And we're not going to cover deeply on that, but I'm just implying, and it's just still a hypothesis. So this is the thing. And the other one, the third one, is also ethnic differences. It looks like from the school that the data they took, and also, this is like about 13 years ago, a still good study. Caucasians were implicated, like, they are more likely to be implicated with ASD as opposed to the rest of the races. And African Americans are followed by Caucasians. Again, what I want you to emphasize is the gender differences is really prominent, very, very big, okay? 4 in 5 is huge. And that's what, as a scientist and as a person who's like in research and public health and all, this is the type of thing you should emphasize on. So I'm going to tell you a little bit about, because my book emphasizes this is not a mental disease, okay? A lot of people think it is a mental, it's not, it has nothing to do with the mind or mental. It's a neurodevelopmental disease, meaning something, somehow, some way, something happened during the development through, like when we were, it could be during the inception, or, the pregnant, the mother had some like trauma issues or something, like it could be related to food. We don't know. And there is no clear-cut answer to that. But it's a neurodevelopmental disease, meaning it is like the structure, the whole structure of the nervous system, more so to the central nervous system, is being affected. So just to, for my audience, what do you mean by neurodevelopmental? I just want to highlight that, like, neurodevelopment means how the neurons, okay, in the brain get networked and synapsed, and how the structure of each, whether it's frontal lobe, occipital lobe, or you see later, the parietal, the temporal, all the brain, the brain is the organ, and the structures, whether they are intact or not, all that matters, okay? But a neuron has typically these structures, okay? It does have dendrites, it does have a soma, and then we have this axon, and the axon is the structure that carries the electrical signal all the way to the end. So information in our brain is transmitted based on electrophysiology. It's like electrical. It's like, like similar to what we see in the electrical, the physical electrical city. So in our system, there is electrical system being transmitted, and that is, orchestrated by the neurons. And the abnormality that we see in kids is related because of that bad network of that electrical cable, which we fibers sometimes, or fasciculations, okay? And here is one structure that I want you to pay attention to, because it's a neurodevelopmental disease. And some research studied that, this is taken from many research. I compiled it, but different brain areas are implicated with autism, and depending on where, the problem is, it is also associated with the behavior they reveal outside the world. Like, for example, this is the frontal lobe. So the frontal lobe has to do with decision-making, also emotional expressions and all that, and which we see also in autistic kids. And also you see number 2 is the parietal lobe. Very critical thinking, and people who have like, for example, high IQ on mathematical skills, but then they don't have any other social aspect or social skills. So again, I'm not going to go on details of those different brain areas, but this is just to show you, it has been studied that it's a neurodevelopmental issue, and the behavior that the kids show has been correlated with synaptic abnormality within all these brain areas that you see, and correlated with the behavior. And there is also a control. It's a control study. That means that people who didn't show autistic behavior, kids who had autistic-like behavior versus kids who had no autistic-like behavior, and then you compare the brain areas. So again, also recent studies also show that in brain areas of the autistic mind, the autistic brain, the circuit or the synapse is somehow very, very messy. So you see a lot of different spines grows at the synaptic area and at the dendrite arbor, and that tells you that there is a lot of synapses. A lot of synapse or a lot of growth doesn't mean a good thing, meaning all the cables are going to be connected with other unwanted or undesired network, and so that creates another behavioral issue. So like the network is confused in a way, we can say, because of undesired or unwanted networking or synaptic integrations in their brain area. Okay, and this is compared with normal versus autistic children. Now, but let me just go straight to what matters the most to us for today, because it's Autism Awareness Day, and we want to, we focus on parents who are affected, somehow, some way affected by ASD, by autism, and what they should do. Okay, so, but before I do that, I just want to, say that there are about mainly three major type of deficits. This is a category, a bigger picture categorically of the behavior of the autistic child. As you might all know, there is a delay in language, which some of you have question about, which we also see in most of autistic children. Poor social skills, very, very tough for them. And insistence in sameness, meaning a very rigid, non-flexible, stereotypical type of behavior that we see in autistic kids. The other thing, and the force that, is not deeply studied, but also very troubling, is lack of any sign of affective behavior, meaning they're not affected, they're not good enough in expressing their emotions. So emotional expression problem is one of the biggest issues. Sunny, please give me a heads up if I am, just with the timing and all that, okay? Because sometimes, I keep talking with excitement. So just
it's 12:30. We can have another 5 minutes maybe, if you, or do you need more time?
I can, let me have about 10. Okay.
Okay.
Is that okay?
Okay, that's fine.
Sounds okay. Yeah.
Okay. Thank you.
All right. So yeah. All right. Thanks. So let's talk about a little bit about when parents suspect issues with their child, or children, of course, should be child. What most of the time is child, but I have seen also parents who had 2 or 3 of their kids being ASD. What should they do if they suspect any issues with their kids? Okay, so when parents detect any developmental related anomalies or abnormalities with their kid, they must, this is a must thing, because it's a very serious issue, because we are fighting against timeline. So they should go to the health facility for assessment, vitals and all that. And then in that, within the clinic, they would have their audiological, radiological, and neurological assessment. This is just, let's say, maybe could be as early as 4 months old or 6 months old, because there are tiny little behavior that we expect, as a function of age, timeline. So, you do that, and then the clinical report would be ready, and the physician will discuss the outcome and the impression of that with the parent or caregiver or guardian. So depending on the finding, they will suggest behavioral intervention if there is autism-related behavior shown by the kid. And this is mainly, but we call it ABA-based behavioral intervention. ABA means applied behavioral analysis. This is a very proven tool to work on, as a behavioral therapy, train the kid on to like gradually adopt a better behavior, and at the same time avoid undesired behavior. And then they have, like, if there is language problem, you will have language and speech therapy. And again, this is also something that we see, like sometimes, the speech is okay and all that, and the problem could be only social aspect. Or sometimes it's only speech related, language or communication related, and you might be referred to a speech therapist as well as communication. So they are they go hand in hand, but they can be treated differently. And then you might be referred to genomic microarray specialist. So what the genomic microarray basically is to deeply go ahead and see deeply all the way to the DNA level, if this is related to environmental or genetic predisposition. So if, let's say, if the chromosome, which, for example, in this case, the chromosome number ID, this number has been missing on the child who was, diagnosed with autism. But it turns out this chromosome was intact, meaning still functional, in his mom and dad. So that means it was not environmental. It was it was environmental, not hereditary. But if, for example, all of them have gene missing, hypothetically say the problem was genetic rather than environmental. Okay, I think the network is back. There was a little bit problem. So before you start behavioral therapy, which I actually, in this book, what makes my book, different is that I am focusing at the family level, like in-house. What can you do? Okay, what can you do? Can you do it yourself rather than, going to an, ABA therapist or some, like, special education school? And which I think, because that is the grassroots, the family, they should know, and they should be given a little bit training on how to identify those behaviors. And that is the main target of my book, actually. So, like, for example, the top 20 or based on high frequency report, this is like based on, data, big data of, millions and millions data unit taken, and these are based on their frequency. So, for example, they might of them show eye contact issue, we all agree. And okay, conversational, okay, hold on, sorry. My cursor is very sensitive. So sign language problem, okay, role of the game, they don't know, like waiting, taking turns, and versus loss also, like, they play, and then if they lose, they tantrum and all that. And all these are the kind of things you should know as a parent or as a caregiver or a guardian. So you have this list. So what you are going to do is you make use of this one to help identify if there is any problem with the kid. So the assessment starts way beyond, way before, like, even during pregnancy. That's what I'm proposing. Like, something might happen during pregnancy. So the assessment should even start before birth, okay, prenatal. So they kind of create this kind of table. So I created this table. So what they do is they put all the 20 items in one column, and on the other column, they just, watch their kids at home, which, elements are on high frequency. Okay, they do it like many times. Let's say, every day they can observe the kid, whether outside, inside, or playing with the kid, with peers, and what, if he or she, in this case we say he because it's high frequent, like 4 out of 5 males. So is he, like, for example, is she or he doing eye contact? Yes or no? Okay, tick. And then how often is that happening? So you do many trials, like 2 hours every, let's say, day for about a week. Then from that, you will identify the most troubling, highly frequent behavior that you want for the kid to avoid, okay? Or like you want to train somehow, some way, which we do have a lot of tools, mechanisms of training. So you can print out this kind of, you can make at home, anyone. It's not a high tech. You just make a table and then just get ready. Like, of course you need a little bit of training. Like, what my concern is, like, in remote areas who don't have any, way to make, even lack of education, that might be a problem. But, people are becoming more and more educated. So making this kind of table is not, difficult. So again, how early should we do that? As I said, before birth, during pregnancy is very important. And my proposal about that is, what kind of event during pregnancy, what's happening, okay? Major change like diet change and traumatic events, not only for the, for the pregnant mother, but also, for even the father, somehow, like, his behavior can be affecting her way of life and all that stuff. So this is very important to do early on. Then keep records. Make use of table 2 that I give you here. Make use of that kind of table and, list all of them, assess and identify the desired versus undesired behavior. Prepare a strategy plan. What are you going to do now? So behavioral intervention, you can, the book tells you how to do it, basically, how you can apply ABA and all that. And this is like, something that takes time, but I'll give you just the gist of it from this, from an example, by just giving you an example, okay? So based on ABA, we prioritize the behaviors of interest, basically high frequency, then we need them. Then we use of prompts, and again, I'll tell you what prompts are. Understanding reward and positive reinforcement learning. This is what it is in ABA. So positive reinforcement learning, which really highly works. Rewarding for good things that they have done, and if not, then we keep trying until we use, like, the visual. Okay, it's getting interrupted again. There are a lot of prompts, visual, modal, gesture, and all that, and I'll tell you a little bit about that later. So the prompts could be, like, for example, I made a table. For example, if we are going to do a therapy training for a session for a patient, a child, or an autistic child needs help with social skills, then we can create this kind of table, okay? And I just took this one from a book. And so we watch the kid. Of course, we have to write the dates. The date is very important to trace, what's happening at the functional day time. Name of child, you can skip it, but in school they can use this kind of also in a bigger population. What kind of task they doing, okay? And then are they initiating the task? If the game, for example, are they sustaining? They have a problem like, for example, kids, autistic kids have maintaining, the task that they already, or the play they already started, they cannot, they give up easily. Do they escape or elope? Are they asking? All these things you can ask and then see if they are doing it independent, meaning without any prompt. Without any prompts means without telling them, hey, do this, or without showing visual, visual prompts or gesture, like, without modeling, like how to do something, or without verbal, hey, and so, can you bring me, or can you continue playing, those kind of stuff. So mostly like the prompts, they go from the very less intrusive all the way to the most intrusive, meaning we don't recommend any physical kind of prompt for the in this kind of training, because like again, physical like meaning you are getting involved and pulling or whatever, pushing, that turns out in neuroscience or in neural circuits, it is something that makes that individual dependent on that. So avoid to go physical when you are doing the training. Again, these kind of tables are all over the book, and you can make use of for just you can make your own at home, and then practice how to use it at home and identify what is the most important behavior that the kid is missing, or what the kid you want to improve. So the prompts that I told you again go from the least intrusive to most intrusive. Okay, so you can use visual meaning, like, for example, you show some sort of drawing. Okay, let's say you want him to drink his milk. Okay, you can either show a cup, and then on it, like showing the picture of the milk inside a glass or a cup. Or you can have also visuals from the laptop, like in a Fancy Life, you can just show them that, and then they can learn. So you don't have to like hand them or push them and all that. The worst you can do is physical, so avoid that. Or like to say eat, you can model, like you can just eat with them. You don't give them, you just model how to eat, and then see if they follow and all that. Okay, I think I'm running out of time. I can see. Sandy, am I? How long do we have?
I am so sorry that in the beginning I took time because of technical difficulty. I think that's what's happening. Okay. It's not because you're running out of time. So maybe 5 minutes is okay.
Sure. So if okay. That is so, then let me.
Or we can go to the questions if you.
I think so. Yeah,
also.
I think we can stop here, and you can share all the stuff if they want to, like the material, the slides with the audience, and they can, I mean, every material in there is self-explanatory, especially for some of the parents who wanted, some material, they can make use of this one, and also they can reach me. So yeah, I'm okay with that. But I think we should go to question and answer.
All right. Okay. Mm-hmm. So thank you so much. Do you want to remove the thing or what you shared, or you want to keep it there as you want? But thank you so much. That was a lot of information, and very valuable information. A lot of people. I'm sorry. Yeah, you're good. So a lot of people come to to me because I have a nonprofit, And because I serve the special needs children, and they asked me about autism. Oh, my son has autism, or my daughter has autism, and what should I do? And I am at loss because my son doesn't have autism, it's cerebral palsy. So this was very, very valuable, because next time people call me, I will be able to, you know, at least understand the concept of it. So thank you so much. And the other thing is, before our session here, I have reached out to a lot of people, and I have asked them if they have questions. With like 9 questions. But before I start asking you those questions, I want to see if there's anyone from the the Zoom, if they would like to ask the question themselves. So I'm going to give them the opportunity. If anybody wants to ask a question to Dr. Yonas on what he said, or anything related to anyone you know, or you're curious, or you have a child with autism, just unmute yourself and you can ask. I see Sanaid. You're unmute. Sanaid.
Yeah.
Unmute. Okay, it's on the. Let me see if I can do it from here. Yeah, I'm gonna see if I can from here. I know it's not allowing me because I already. Okay, yeah.
Now, can you hear me?
Yeah. Yeah.
Hi. Yeah, this is Sanaid from London. Can you hear me properly now? Can you hear me?
Yeah, I can hear you.
We can hear you.
Yes.
Okay.
Yes, Sanaid.
Yeah.
Hi, my name is Sanaid. I'm from London. I have got 20 years old autistic son, and he was educated in special needs school, and because he was not doing well there, I took him out from the school and I educated him for 2 years using ABA program. And he was showing huge progress, and he was having good eye contact. He is nonverbal, but he has got few words now. He can able to express himself with few words. He has got good receptive language, but his expressive language is very poor. He has got sleeping difficulties as well. Now, after 20 years, he has got seizure. First seizure was in November, and the second was on 19th of April, which is 3 days ago. So I don't have any clue how to handle seizure. He had the seizure at school, not at home. So if you have got any advice regarding seizure, will be appreciated.
All right. Okay. Okay. I'm sorry to hear that, Sanaid.
Yeah.
It's really strong here. So, you know, the brain doesn't stop like growing like up to the age of even early 21, or sometimes it goes up to mid 20s, like human brain. So the fact that this is a neurodevelopmental issue, and because we don't know the developmental problem that's happening, like the network issue and all that, the new, like, as you said, it never happened and never happened at home. And what we can propose is one, you know, something that the brain's still growing, and a network that you saw from the presentation, for example, the synapses might go and, you know, creating chaos within, you know, especially deep inside, like the binula and all that stuff. Again, we don't have to, that resulted with the revelation of a new behavior. The other thing is, okay, I think, okay, I'm just, okay. The second thing is because it's only happening in one area and not at home, maybe some stressful situation might be happening, and something that he didn't like could be like related to olfaction. Now again, you know, they are very sensitive. Olfaction, like the smell, sense, audio, auditory, the visual, all these are, you know, in autistic children, they are very, very sensitive to the point they can do and, you know, they can understand and hear and listen, or, you know, feel tiny sensory input where, you know, at normal circumstances we couldn't. So these are the kind of things you should try to find out. What you be a researcher on yourself, what new has happened. Like, this is the thing you should question yourself. Okay, what is new, what happened? Okay, especially in school, if there is some sort of, like, you know, external, you know, trigger coming. Okay, the other thing is I would really an expert in seizures and all that, and consult, you know, this, you know, it's very important. The earliest, the, you know, the better. So those are my take. I am not a neurosurgeon. I'm only just a researcher in brain and all that, more of biomedical research. But if I were you, I will do this, like finding the new thing that change, and also at the same time, you know, reaching out for help, like the way we're doing, right? This is a good information, but reaching out also to, you know, the doctors out there who are specialized in seizure. Again, be very careful, because, you know, medicine these days is becoming more and more, sometimes, you know, they just want to do, you know, like you don't have to, so be careful. So, you know, weigh out your cost and benefit analysis and all that. Okay, that's all I can say, but I think it will be fine. It'll be fine. Just don't give up.
I think she's talking and she's in mute again. You're on mute,
Yeah,
Chennai.
yeah.
She's saying something to you, but she's on mute. Chennai. I black. Okay. So I don't know what's happening, but she's not able to.
It's okay.
Yeah. So
I think now it's working. Yeah.
Okay.
Yeah.
All right.
Can you advise me about sleeping difficulties? He has got sleeping difficulties because they say that seizure comes from sleeping difficulties, tiredness, stress, alcohol, drugs. So one of the requirement which is can fit the affect is in sleeping difficulties. So how can I help him to sleep well?
There are, okay, so in my book, there are some apps that, you know, stimulate the sleeping pattern, like the rhythm and the wave of the brain, so that there is a dream pad app. A dream pad will help you also. But there are also some medication, which I would rather try those apps, like non-invasive ones, because, you know, taking medication, sleep medication also might have its own drawback, like, you know, being dependent and all that stuff. So try, you know, those, like, because the sensory system might be too busy sometimes, to the point you become like restless and irritated, and all this thing that, you know, we don't know even really, you know, multiple input coming into the system is making the whole organ, you know, the kid basically restless and sleep, you know, like confused. Basically, he might feel like we can, you know, we want to go to sleep, but then, you know, all those stuff is making him not to go to bed. So, you know, the app I told you, and I will send you some other time, maybe Sanait will organize somehow, that would help. The app is called DreamPad, and I have it in my book, so you can read about it. And also, don't really underestimate the effect of vitamins. And also some vitamins are very important, but like there are some drugs that are not really, I have it on the slide, but they're not, their side effects are very, very, very low. And they might help you release histamine, and the histamine might also somehow help him not to be irritable, sensitive, and then maybe put him in a relaxed mode. So again, there are out there. I mean, before we go to the actual prescription drug, try those, and then if it continues, then we'll try to go to the actual prescription drugs. Okay.
Okay. Thank you so much. Thank you for your help.
No problem. Thank you.
Thank you, Sanai, for your courage to speak up. This is not an easy thing to discuss, like seizures. My son has seizures as well, so I know the struggle, and all we can be is strong and try to help our children. So is there anyone who has a question before I start asking Dr. Yonas the questions that other people sent me? If you have a question, unmute yourself and ask.
We have a lot of how many? Okay, there are.
Yeah.
Okay. Yeah.
Now we have. Yeah. So I'll just raise your hand or unmute yourself and talk until you do that, or until you figure out what you want to ask. I'm going to ask Dr. Yonas those questions. We're a little bit late. I scheduled this Zoom meeting until 1, but we had some technical difficulty in the beginning. I was going to broadcast to live Facebook, but we had problems. So it took about 12 minutes of our time, which is why we're over time. So for those of you that have commitment, you can leave, and I'm going to share this video. It's recorded, so I can share this video with you if you have time commitment. If not, stay and listen to the rest of it. This is Q&A with Dr. Yonas. So the first question I have, Dr. Yonas, is a mother sent me this one with autistic child. There is a belief in our culture, if a kid isn't speaking even at the age of 3 or 4, they say he will speak, don't worry. So I lived in denial for years. How can we break this cultural belief and look for signs early on? What sign? Well, you answered already what signs they need to look for, but that's one thing. How can they break that?
Okay, so I'm going to be very brief, so that we don't take time. I mean,
Yeah.
I could have talked a lot, but I'll be straight to the point here. Yes, so that's why we're doing this. That was my target again early on when I started. We want to reach out to the community, and because the lack of education and awareness about how science and our lifestyle works, that was so my book would tell you more about it, but that was we have to educate. And I will, if I get some time, I would travel and reach out to the community and speak up, they create awareness. So yeah, again, it's not even 3 to 4 years, you really don't have to wait up to even 1 year. Early on, like the bubbling tongue, especially the social skills, the social skill development in neuronal development is earlier than the language itself, the motor. So you see those. If you don't see those, you don't have to wait even until like they try to speak up and all that, So try, the table that I created that you saw, it really will help you track. It's a kind of tracker you know, daily tracker so that, you know, hey, this is happening so and so, like this much, so we have to do this. It would help you. And also it would avoid confusion during diagnosis when you go to the physician, really. So that's the kind of thing we are trying to create. The newer generation, teach them, educate them. They can do it at home so that they won't be confused. And, you know, we go to clinics and hospitals if only if it's something must thing. You know, this is like a management issue, honestly, to be honest. It's manageable, but it requires a lot of patience. Does require a lot of patience.
Thank you, Dr. Yonas. There was another one that was similar to that about stigma. So I think you're going around it also. So stigma, there is a stigma. This woman asked, how do I overcome the stigma? So I feel so embarrassed when my son acts out in social events and everybody in my culture is looking. I want to take my son to the church, to social events, but their judgment looks just, you know, terrifying me, and I rather not go. So parents struggle. I've heard this before too. So what would you advise those parents to do to be part of, you know, the culture?
So on, right, Sunny. So on chapter 6 is completely, talking about advice to parents and caregivers. Can you hear me? There is internet interruption a little bit. And they can read from chapter 6. It really, this kind of culture related and all that stuff is broadly explained in there. But what I can say here is acceptance is very important. Anything can happen in our life. And kids, irrespective of how they come to us, you know, they are the most precious things we can have. It's our DNA, and somehow, some way, it could be altered, whatever, but we have to accept. So the stigma, I'm trying to be blunt a little bit here. The stigmatization is not a big issue when, like, you have to accept, you know, whatever he does, you know, he's doing that because he feels that's the right way to do, okay? In the society, acceptable and all that stuff. So do not be ashamed of what he does, okay? As long as you know what's happening. So buy it, accept it, and then do your best, how best you can shape it up. And that's what I think it is, you know, like more than anything, the kid has, you know, taken all the burden and all that. So we don't have to be ashamed of anything, honestly, because we are not the creators. You know, we should look at it from that perspective. So we have to accept it and then do our best.
Thank you, Dr. Yonas. I think what I'm hearing is, as a mother of special needs child, even though he doesn't have autism, what I see is, you know, sometimes we take him, he's on a wheelchair, and then, you know, people stare and they try to talk. Yeah. And so what I hear you say is to be strong. If you accept your son the way he is, then you teach others to accept him too. But if you're going out and feeling ashamed of what he's doing or he's disturbing, then you are not in a position to actually alter the perception of, you know, the culture. That's what I'm hearing you say.
Exactly.
And the struggle is the same.
Yeah. There is lack of knowledge in the community, in the society. They don't know what kind of pain you're going through, you know. So you be there out there and show them you can do it. But if you, like, you know, make yourself or put yourself in a weak position by just, you know, you just you know, accepting what they say, and it's not right, it's not true. I mean, it's not the right way to handle and bring a solution for it. That's my
Thank you. That was amazing. Yeah. Okay, thank you. So I have 2 more questions. I have a lot, but I'm just going to do 2 more because of the time limits that we have. So those are very important. This someone from Auckland asked me, a mother, actually, let me skip to the other one because this one. it says, I just had a baby and someone told me I should not have my son get his vaccinations because it causes autism. Is this true? I am scared what would happen if I don't get my child's vaccine, and at the same time, I don't want him to get autism. Can you shed, I know that's there also in your book. I'm going to offer to the participants, but can you quickly share what you think about that?
Okay, so here's the thing. And even, you know, like so here's the thing. You know, as a scientist, what you need is, you know, proving or disproving the hypothesis all the time. To do that, you have to collect data and analyze it and see if whatever you think is right or wrong. So the idea that some vaccines might cause, you know, problems, diseases, including, you know, a lot has been said, but without being proved. But then there are also tiny element to that, some sort of truth to that as well. What I can say here is that, you know, that we have to weigh in and see the cost-benefit analysis of not doing it. Okay, so I'm not saying, you know, there is no you know, cause of, you know, autism by vaccine and vice versa. I'm not saying also there is, because we have to prove or disprove. So I have to be very careful here. But we have to be suspicious. Why are we hearing this? What are the contents in there? So in my book, you would see, you know, what are the things, and you know, what can we do? We have to weigh out. So again, what percentage of the kids who have taken that vaccination have had that, you know, that, you know, have had autistic related or ASD related behavior. These are the kind of things you have to investigate before you decide. So weigh in and see if you like it or not, and then decide, because you're deciding a very decisive part of the life of the kid, and you are the only one, the parent. So again, I cannot tell you this and that, but be suspicious, read, and then weigh in. You know, what happens if you like keep quiet and not take the vaccine? Can you take the consequence of not taking the vaccine? Because we take vaccinations also for, you know, there are a lot of diseases that being healed or cured by taking, like the, you know, anti-sex and all that, the combinatorial, all this polio and all that stuff. So can we, you know, you have to do your cost benefit analysis in this case, and you be the, you know, the decision maker on that. But these are the kind of things you should be very careful about.
Thank you so much. I think what I hear you say is that we need to think like a scientist, even though we're not, you are, but to think like a scientist. There are so many rumors this is happening. We don't know from scientific point of view whether it's true or not yet, because you guys are doing research if that's true. But until you tell us that's true, to weigh in, okay, if I don't get my son or my daughter vaccinated, then will I be able to live with the consequences? Maybe he will have a polio or other diseases for something that's not proven yet, is what you're saying. So at the end, it's my decision, the parents' decision, whether to do that or not.
Okay. Yeah, true, true. Yeah. That's exactly what I am trying to say. I like, you know, don't be like, you know, any kind of decision. You have to read, ask, and see, weigh in, and decide, do the best decision you can ever do. And that's what, this is very sensitive. A lot of things are, a lot of elements, you know, participating, especially in vaccine related things. The question is, we know some part of it works. If you have 5% error out of 100, can you take that? That's the question we have. So, you know, a little tiny bit of an error could happen to any kind of, even for COVID and all that stuff, you know. A lot of people haven't taken their COVID because of, you know, suspicious suspicions and all that, right? So the same happens to all, you know, other vaccinations. And so, yeah, there is a little bit window to that again.
Yeah, nothing is perfect, right?
Nothing is perfect. Yeah.
Thank you for shedding light on that, because I keep also hearing this a lot. So the last question that I have is, this is from a mother from Auckland, and she says, my daughter's behavior is becoming unmanageable. We tried ABA, we tried everything which was suggested, and it's supposed to help, but it didn't help. She's homeschooled and her behavior is out of control. Should we try any medication to help her calm down? What advice can you give? And I think she also said, would melatonin help? So
yeah, even actually with what Sanait asked also, melatonin might help also. Is one of the melatonin is basically what it does is a muscle relaxant by activating the serotonergic system, basically. There is but more specifically at, you know, during the night rhythm, like the sleep time. And a lot of people actually take it for sleep and or relaxing and all that stuff. But again, the long-term use and all that, we should weigh in and see what happens. Again, in the question presented from the mother from Auckland, behavior is too much. I mean, like, you know, you have to be very specific, which kind of, I know she could have gone through a lot of uncontrolled behavior. Can you hear me, Sanait? Yeah, so we are not too sure. Like I would love to hear her saying specifically what, because in a broader sense, behavior is very tough to explain. So one is that one. The second one, if you go to ABA, which are many around in the Bay Area, I was actually going as far as, you know, to your area, Livermore, and also San Jose. In San Jose, I used to go there as well. You know, like whatever they do there, if you don't replicate at home or somehow, some way, you don't apply it, or you don't try to apply those procedures at home, that could be also another issue. They might create a confusion and all that. And also, how old is she? How old is her daughter? 20?
I think she's between 10 and 11.
You know, 10 and 11. So, you know, the change, as I said, it's always good if we could to be researchers ourselves. Anyone can research, to be honest. I mean, if we can make, you know, cook at home, that is what research is. What makes, you know, your you know, your table, your food, you know, better, you know, like you refine it as you go. And this is how you refine it. What changed? What changed, and what could I do better? And what did I, even what has changed from my perspective, from the parents' perspective and all. You cannot do the same thing again and again, really, because if it doesn't, then, you know, they will be bored too, especially autistic kids, you know, they're out there confused and all that. So you should be very careful the way you do things. Like two different environments might be hurting her because she's going there and then she might not get, you know, she might not be replicating that at home or doing it again at home. And that could be also something that, you know, creating confusion and all that, change in the behavior, like it could be tantrum, it could be any, we don't know. It could be, you know, there are also sensory overload causing other people, you know, like chaotic, like very, very, very.
Yeah, so this question was asked in Tigrinya language. So I had to interpret it, translate it to English. So, but when she said the behavior out of control, she was referring to tantrums.
Yeah, it could be tantrums. Yeah. And tantrums are very, so that's the last thing they can do, because tantrums could happen due to lack of sensory stimulation as well as because they could be nonverbal, lack of communication, all that, because they're not, delivering what they want to deliver, the message they want to address, then that's the only way they can express themselves, by tantruming, so that in case you do something for them. And yeah, tantrums are really bad. And but they are manageable so we call it the ABC method of handling it. ABC, like antecedent is something happening before what happened. B is the behavior, so then you have C, the consequence. So if you know the source of the problem, then you try to bring things into the statistical, like the stethoscope, like you make it like back where it was, because these kids, a tiny bit of change, even in routine, is really might be furious and it might be dangerous. So those are the kind of things you should pay attention to. And ABC helps a lot, and in my even Tigrinya Amharic book, it's really well explained up there. That might help. Also, you can refer to her, what she can do, and they can apply it really based on the ABA in Tigrinya already there, just in our context in Amharic as well. So I think I would recommend her find it somewhere.
I'm sorry. So I think I missed it. You said there's something. Is it an app, ABC or AB? Something?
ABC is no, it's not. Well, I don't know if there is an app, but ABC is antecedent, is like, if let's say tantrum happened, or let's say they are trying to go away from something, or like like escaping, or like avoidance and all that. You want to fix that, and it's very tough for you. So you be vigilant and very observative enough to see what you can do. So you should know the source, antecedent, you should know the behavior itself, and then the consequence. What did you do to solve? Okay, so the first suggested, based on ABA and all that, applied behavioral analysis, is that bring things to where they were, the status quo, right? The status back. And then, okay, let's say they were drinking coffee, or they were or the kid was playing game. You can put it back. And then there is also another procedure called and then, like, okay, I'll give you your iPad. After that, do this. If you do that, you can just, because their mind is very malleable sometimes, you can tweak it a little bit. But the ABC system is just like that. So you have to know what happened and then what you did.
Okay. Okay, I was a little bit confused there. Thank you so much. I think what I heard you say, answering this parent's question, is number one, tantrums are everywhere, right? My son, my 4-year-old, has tantrums. I'm familiar. I'm familiar about tantrums, me and my husband. But with autistic children, that could be, problematic. But the ABA maybe is not working for her, probably because she's not following the instructions they gave her to come back home. One possibility could be to come back home and then apply that. I also see it on myself. I go to the doctors or somewhere and I expect miracle, fix him, and then that's it. But they give me something to work on at home, and I might not apply that. So one thing to look at is maybe the ABA is not working, probably because it's not applied at home. That's one thing I heard. And melatonin is okay and to give because
but she has to consult with her doctor.
Okay. Got it. Okay, consult her doctor, and then melatonin could help, like, relax her. And
then they can sleep. Yeah, well.
Right. And then the third thing
hold on. Can I interrupt you here? There are apps, like the way I told her tonight. There are apps like come through your iPad and everything. Apps like the DreamPad or something. this is at the end of chapter 3. You'll see it. There are about 10 of them, different ways to how to deal with those kind of situations. And one of them is like the iPad or DreamPad. Yeah, DreamPad, especially for kids. So it does produce some like temperature that stimulates the skin to, you know, gradually go to bed. And again, you know, how would you make your kid to do that so that, you know, they understand they want to go to, like, you know, sleep? Because there might be lack of communication as well, in terms of, like, you know, she could be nonverbal, or, you know, she might be not listening to the mom and dad and all that. But I think the one way to do that is, you know, without even medication, without melatonin, they should try that app also. It would help.
Okay, got it. So there is a Dream app. It's called DreamPad. And
DreamPad, an app, yeah.
Okay, yeah. Before she tries the melatonin, to try that one first, and then eventually, if it doesn't work, then she can try the melatonin after consulting the doctor, her doctor.
Yeah,
right?
also check out her diet, you know.
Diet,
very important, yeah.
And check out her diet. And then the other thing I heard you say was sometimes maybe if the child is doing the same thing again and again, she could be bored. So maybe she can take those questions to go back to ABA, whoever is her ABA therapist, and tell them what the issue is so that they can fix it. And the third thing I heard you say was, well, those were, observe. You said the parent also could observe what's causing the tantrum, and to track it. Okay, what did I do to cause this? And then kind of record it. This is when you were talking about the ABC. Observe, and then track. Maybe if I do this differently, and then they have to play with that. Is this accurate? And of course, she also requested the book, so I'm gonna give it to her. That's on chapter 3 about the DreamPad. And I'm also gonna send Senait Berhe the book, because they both requested your book. That's all I have. If there is no other questions, we're not on live because of technical problems, so we can't ask there. But if there is anyone who has any more question for Dr. Yonas before I let him go, raise your hand or put on the chat. We'll just give it a few seconds.
Yeah.
Any questions? Any more questions that he did not answer? All right. I don't see any more questions. I really thank you so much, Dr. Yonas, for taking your time from your very busy schedule to come here to talk to us, to educate us about autism. I tell you, like before this, whenever parents approach me, I had no idea some of the stuff you said. I'm leaving from this meeting, gaining a lot of knowledge and a lot of information that I am going to share personally with people that come to me, because I have the nonprofit, and I'm sure a lot of people here have benefited from it. And one of the things that I'm committed to is that our community is educated, so that our kids can be accepted and loved, and they can be part of the society, and then parents don't have to feel like they have to hide their kids. So
exactly,
thank you.
That's the thing, that the stigma. You see, if you really understand the biology behind it, honestly, because people, feel like stigmatized, or being what do you call, outcast or something, is if they know the biology, the chances are they wouldn't feel that kind of feeling. We all are different, and our biology and everything, the way it's set up, we all are different, and that's what it is. and you can, we don't have the power to fix it. So the only way is buying it, be it, and, try to fix the problem. And, there is help out there, just be open about it. That's what I can say.
Perfect. Thank you. Thank you so much. Thank
No
you. And
problem.
I hope
Thank
to
you.
see you soon.
Thank you too.
In another event.
Thank you so much, Sunny.
I'm so sorry. I actually forgot. I'm so sorry that whoever is in this Zoom meeting who might be interested in Dr. Yonas's book, we as Aaron K Foundation, a nonprofit, has purchased the English version. So we have 7 more left. So if you want to get one, we will ship it to you. You just have to reach me or Dr. Yonas and let me know, and then you can send me your address and then we will send it to you. And this is free because we are a nonprofit. So let me know. Thank you. Thank you so much, Dr. Yonas, and I'll see you soon in another event. Okay, thank you everyone for attending. That's it for me.
Thank you so much. All right.
Bye.
All right, Sunny. Bye now.